The procurement and retail of over-the-counter and prescription drugs have become areas of concern for persons who are seeking medication at pharmacies across the country. The issue was once again raised by activist Giovanni Brackett, whose presentation on the matter has prompted the Ministry of Health to respond to questions raised about generic drugs versus name-brand medication that have been approved by the Federal Drug Administration.
FDA approved this for a U.S. market. That is a different situation from what happens in Belize because we don't have the full listing of what's FDA approved for use in the U.S. versus outside of the U.S. So that is done on an individual basis. In terms of procurement for us as the Ministry of Health, we do that through the open tender process. Tenders are done once a year. It's an open tender. Anybody who has an established company that has a duly licensed to import pharmaceuticals can submit a bid. There's a tender committee that goes through that process. Items are selected based on specific criteria. Those items are then submitted as in the form of a contract to the CEO for signature with the individual company for procurement.
While Brackett does admit that not all generic drugs are harmful or ineffective, he questions whether proper tests are conducted to measure their effectiveness.
I will say categorically that not all generic brand is bad, but I believe that from the complaints that I've heard, there's a lot of inferior products that is on the market. A lot of product that is out there in Chinese store, Indian store, and they are not effective. And I don't know, since the SI has passed, the latest SI that put a lot of stringent measures on for wholesalers to import these name brand product that was always on the market. Since I don't know if they have been doing a proper audit and to test the effectiveness of these generic brands.
Director of Health Services Dr. Marvin Manzanero addresses opinions that have been formed by many when it comes to generic drugs. He says that the procurement process involves good manufacturing practices as well as other necessary requirements.
There's also this perception, and I think it's perception or notions that because it's a generic product, it doesn't have the same function or same pharmacological background that substantiates its use. But that's the reason why we ask for a GMP, a CPP, and a COA, because we don't have the mechanisms in place to do the testing for all the items that are circulating in our market. So once you ask them for that certification process, then that becomes your document that substantiates your procurement of a specific item.
Manzanero also describes the tendering process by using a basic example.
When we do our tender process, we do not put any brand to the product. I mean, I'll use a simple example of maybe an antibiotic, amoxicillin, which is a more common one that people are aware of, or ciprofloxacin. Once the tender process goes out, it will just say ciprofloxacin, the specific amount that we want, the specific dosage, whether it's for adult or pediatric. That's what goes out in the tender item. And then the suppliers can submit their bid and they can choose from wherever company they are dealing with. And then it goes in, when they submit their tender item, then they will submit by whether the company is from India, Costa Rica, El Salvador, the US, the UK, wherever. What we do as part of the tender committee is we do the selection process based on cost, based on the supplier reliability, based on whether the item that we are procuring has a GMP, CPP, or COA.
Reporting for News 5, I am Isani Cayetano.